Just like we spoke about all the disease conditions that could occur to the tricuspid valve, we are taking that same energy to the pulmonary valve. So we'll be talking about the pulmonary valve diseases. So all the types of medical conditions that could actually go wrong with the pulmonary valve. Alright, so what we got here is this. Pulmonary valve disease just refers to problems with the valve. Okay, that's the pulmonary valve. Where is the pulmonary valve found? Pulmonary valve is between the right ventricle and the pulmonary artery. Do you understand? So let's look. Okay, so the pulmonary valve controls blood flow from the right ventricle into the pulmonary artery. Okay, so that's the valve that controls how blood enters the lung. You know, the right side deals with deoxygenated blood. So the deoxygenated blood will be sent to the lungs to get oxygenated. So imagine that enough blood is not reaching the lungs to be oxygenated. You know, a whole lot of issues, you know. So the disease occurs when the valve could be narrowed. The valve could be too slacky that things are leaking out. The valve could be malformed, leading to inefficient circulation, strain on the right side of the heart, and the rest of it. So types of pulmonary valve disease, we have the pulmonary valve stenosis, where the valves are thickened or fused. We have the pulmonary valve regurgitation, where the valve is not closing properly. So blood is now leaking back into the right ventricle. Like from the right ventricle, blood is pumped to go to the lungs, but it's leaking back, you know. So that can cause volume overload, you know. You have to be wary as you are supposed to be at all times. So if blood that is supposed to be in the lungs is not in the lungs but in the right ventricle, another blood is coming from the right atrium to add up, volume overload. This could actually make what? Right ventricular hypertrophy. So you see the way you can walk these things. Then we have pulmonary atresia. That is a congenital defect where the valve is not forming well. You understand? So blood cannot flow normally to the lungs. Okay, so symptoms. What will patients with these issues usually suffer from? So, you know, we have shortness of breath, fatigue and dizziness, chest pains or palpitations, swellings in the legs or abdomen, then a bluish skin. That's what is known as a cyanosis. Okay, so diagnosis, we have the echocardiography, we have the electrocardiogram, we have the cardiac MRI or CT scans, then cardiac catheterizations. So treatment, mainly they suffer from fluid overload, right? So you give diuretics to take out the fluid. Balloon valvuloplasty. If there's stenosis, there's a balloon they insert there to basically make the place wide again. The valve replacement or repair, you understand. So lifestyle changes, like they have to quit smoking, they have to stop taking alcohol, and they'll start managing for blood pressures, also monitoring their blood pressures as well.